As we say, that the National Health Insurance Bill has been met with a lot of resistance from opposition parties and civic groups. The concern is that in its current form, it will hinder universal health coverage for all South Africans. For more reaction on this, I'm joined by the South African Medical Association's Dr. Mvuyisi Mzukwa. Dr. Mzukwa, thank you so much for your time this evening. We do appreciate you speaking to us. So you've said in the past that the South African Medical Association does not support the National Health Insurance Bill in its current form. You've given the following reason, and I quote, you've said it sets up the healthcare system for failure at the expense of further deterioration of the health and well-being of all who live in the country. Can you give us an explanation how it does that from your viewpoint?
Good evening to you, Anli, and to your viewers. Thanks for having me in your program. I do believe that we are really facing a challenge because there are so many issues that have been identified. For example, we are going for a change from a provincial system to a district management system that has not been tested before. And there are so many other issues that we've identified. There is not a proof of concept. The pilot project had failed before, and we don't know how you are advancing a bill without evidence.
The government's ability to administrate such a massive sum of money without corruption has also been brought up by yourselves, by opposition parties, by civic organizations as a major concern. Yet South Africans, many millions of South Africans are in desperate need of equal quality healthcare. The bill has now been passed by Parliament. How do we move forward from here?
We must continue to engage, Andy, because there are so many issues that need to be rectified. For example, we need not focus only on finance. We need to think deeply about leadership and governance. We need to think about many other issues that are affecting the healthcare system. For example, the dire shortage of healthcare workers. We're sitting at 30% of the workforce as the World Health Organization. So we can't rely solely on NHI, which is going to purchase services, and it's not going to build hospitals. It's not going to employ healthcare workers. It's not going to bring medicines. So there are so many issues that we need to think about when we talk NHI.
Are there any good things about the bill in its current form?
Well, the fact that they've changed from the powers that were given to the minister now to the appointment by Parliament, I think that is a good for us. We've been advocating for that, and I do think that on that one we commend the committee. But regarding the other issues, we are still uncertain because there are so many details that are not coming up from the bill. We will wait for the regulations as they come.
Many ordinary South Africans, with the pressures of work and home life, just trying to survive, put on top of that load shedding, the water crisis, they simply don't have the time to sit and study this bill. So for those people at home who may have been following the news about the bill to a certain degree, but really are worried about how it's going to affect their everyday access. And we know South Africans have access to healthcare on very different levels. Some South Africans have access to very basic public healthcare, and they have their own struggles in terms of that. We know our infrastructure simply can't cope. We also have some South Africans who are privileged in that they have access to private healthcare. They are also concerned that the money that they are investing in looking after their health is not going to be utilized the same way should the NHI come into practical effect. For South Africans on the ground, how's it going to affect them, do you think?
Well, I do think that South Africans must not forget that we are going for 2024 elections. This is being used for electioneering And we don't think necessarily there's a political will to change, the healthcare system in the country. You must look at what is happening in Gauteng, cadre deployment, and all these things. Deploying people who are incompetent in very, very strategic positions. I think here this time around, South Africans must be told the truth that it's not going to happen tomorrow. It might come in phases, but we have to fight for details so that South Africans get a good quality, equitable access to healthcare in South Africa.
What about healthcare professionals? Because there are many doctors in the private healthcare sector who've said, the only way for them to make a sustainable living is in private practice. What do we see happening to healthcare professionals in South Africa when we already have a shortage in some areas?
Well, there is no certainty. That's why you see some of our colleagues going abroad, because there's no certainty about the NHI. But also we have seen what government has done before, where government has not paid service providers for many months, without any payment. So, those are the real fears that people are feeling on the ground. And that's why some of them are packing and going. And we're not saying that because we are fearmongers. It's something that is happening already on the ground.
Are you, as the South African Medical Association, looking to challenge the bill in its current form or to push to make necessary changes?
Yes, we are working with other doctor formations, other people who care about South Africa, to make sure that this bill, serves the purpose and is fit for purpose. That is why we've been always making submissions to the portfolio committee, making sure that our views are understood as professionals. And we are going to collaborate with other professionals, making sure that this bill really becomes something that is can provide a good quality health care in our country.
One of the criticisms, though, is that submissions from experts and the views of experts have been ignored in the formation of this bill. So, what level of confidence do you have that those submissions will bear fruit?
Well, we just hope, because we are told this is a listening government. So we just hope that if we continue engaging, we can find each other with government. But we know that, sometimes if things are just pushed for political reasons, you might find that our views are ignored at the detriment of, the healthcare in the country. We've already made noise about many other things, including this cadre deployment that deploys people who are incompetent, and the issue of corruption. But as you know, some of these things are ignored, and people cry foul when everything crashes. I mean, same thing we see in the UK, in the NHS, where doctors were on strike. But also, what we've seen is that there's a big backlog of operations, where now people are coming to South Africa to get healthcare services because they cannot be catered for in their own country. I wonder if this happens in the UK, first world country. What will happen to us, the third world country?
It certainly is a very scary time. Change is never easy. Thank you for your submissions, and let's hope that with continuous input from medical professionals and experts in the field, that we will get this bill to a place where it does serve its purpose of providing equitable health care for all South Africans. Thank you so much for your time. That was Dr. Mvuyisi Mzukwa from the South African Medical Association.